Hi guys, happy Friday, good morning. Welcome to another episode of Ask Dr. Ben. It's October, towards the end of October, and it's Dental Health Awareness Month. So I like to take this opportunity to talk about a topic that's near and dear to my heart, a cracked tooth. It's a condition that we've been asked a lot, deal on the regular basis in the dental office. So what is a cracked tooth? Um, our tooth, our teeth sometimes break upon impact, and um, that over time the fracture can get a little bit bigger and deeper as we grind and chew and use our teeth. So who's at risk for having cracked teeth? So some people are more susceptible to having cracked teeth, and the risk factors are, say, if you have a big filling, um, the big filling is deep, and you have a really little tooth structure surrounding the filling, or if you play any contacting sports, football, um, hockey, or boxing, or basketball. So those are easily, could lead to potential hitting in the mouth, in the face, and causing the tooth to crack. Another common reason is that if you clench and grind your teeth, especially at night, the force that's generated by our jaw is it's pretty tremendous. Or if you have a balanced bite, that could also cause the tooth to crack, because the concentrated pressure on certain teeth over time with the repeated chewing pressure, that could tend to lead to some damage. So how do we prevent our teeth to crack? You wanna have your dentist take a look at all your teeth and make sure that the structural compromised teeth, you might want to consider putting a crown, a cap over to protect them. You might want to consider having your bite equilibrated or adjusted, or have a night guard made if you clench and grind your teeth at night. Definitely have a sports guard made if you play sports, contacting sports especially. So those are the common prevention. Oh, and definitely, if you have big fillings on certain teeth, especially the posterior molars, definitely have them replaced out with some restoration that will cover the cusp and preserve the integrity of your teeth. Now, what happens if you decide not to do anything and just kind of monitor the situation? Well, it's likely that the fracture will deepen over time, and what will happen is that sometimes a cusp of tooth will break off, or if the crack gets deep enough, it might affect the well-being of the nerve. That's what happened to me. A few years back, because of my clenching and grinding, I cracked a molar, and initially I just have a little bit of temperature sensitivity, and I ignored it, thinking, I'm a dentist, what could happen to me? But hey, well, it did. It continued to get worse, and what happens is that one day, the nerve got so bad, the nerve damage got so bad, it woke me up in the middle of the night, and it hurts like you wouldn't believe it. Well, I guess some of you could believe it. That's why you come in, give us a call, and say, hey, this doesn't feel right, kept me up all night. So on the worst case scenario, the crack could extend all the way down to the root and crack the tooth in half, and in that case we have to take the tooth out. So definitely have that looked at. Get that addressed. Prevention is the best therapy in this case. Also, Halloween is just around the corner. I kind of want to share a little bit of tips as far as parenting, how to deal with the excess of sugar and candy that the kids are gonna get. So I think it's very important that you know, well, we have three kids. They're in the age of 9, 7, and 5, and they look forward to Halloween every year. It's a happy time. You know, it's I think what's important is that the experience. They love dressing up and go out and you know, trick or treating. It's fantastic. And as parents, you know, we want to make sure that they have that good experience, that they're happy. So we let them go trick or treating, and when they come back, you know, we lay all the candy out on the table, and we trade. So we'll give them a quarter for little candy, and 50 cents for medium size, and $1 for a big one. So, and they get to keep 3 or 5 candies if they like. You know, it's a Halloween, and they're happy, and then, you know, they still have a good experience. So that's hopefully that will work. And you know, some dental offices will offer the candy buyback. You can also take those candy that you trade with your kids and get a few dollars back. So, well, hopefully everybody will have a nice and safe Halloween. And thanks for watching. Please leave me any comments or thoughts that you have, and share the video if you like. Thanks so much for watching. See you next week. Bye.